Okay, hi everybody. So glad you could join us, and I'm happy to do this. Jeanette asked me to do this. I think I offered to do it, or she asked me. I can't remember which one it was, but about a month ago, and I said sure. I'd really like to do that because we had just started the pandemic, and I thought, gee, how relevant. So let's get right to it. There we go. Goals for the presentation. Here's some of the things I want to cover tonight, and you can read what's up there, but I want to give you kind of a background of the nature of the 1918 influenza and how it became a pandemic from the standpoint of where it started, how it spread, some of the contributing factors historically that led to that. But more importantly, what I really want you to understand is that the impact it had on the day-to-day lives. And I think what I did for that research is I spent a lot of time on what we know here in East Coast is FultonHistory.com, which is a free newspaper site that really allows you to get into the old time newspapers. And I did a lot of research in those newspapers to find a lot of these stories that we have here today. So that's what we want to cover for today. Okay, quick overview. These factors, and you can see, I pulled up some of the more interesting overall statistics from the pandemic, but you can see in the parenthetics, I tried to juxtapose that to what's going on today in terms of some of the numbers. Now, these are as of yesterday evening. I pulled these numbers from CDC department and New York State Department of Health, where I got some of our state numbers. But you could see during 1918, 1/5 of the world's population. So back then there was about 1.5 billion people on the earth. So you had what, 500 million people infected with the virus. And the next point, the estimated deaths, I will tell you the variation there is almost universally debated. And almost universally, people will say in every report that I read that they was great underreporting. And you're hearing some of that stuff today. So you can see 40 to 100 million people died worldwide in 1918. And you can see our figure today worldwide as of yesterday was 250,000 people, so huge difference. Now, obviously, we're not done with ours. We've just started ours. So obviously those numbers could and will go up. Just in the USA alone during that 1918 to 1919, thereof, about 500,000 people died. And you can see where we stand today at 65,000. And again, we're in phase one of everything. Some of the more, you can see some of, so now I'm going to, the California figures by late 1918, I apologize, some of these are kind of apples and oranges, but just for 1 month, for example, in New York City, you had 35,000 people die, and that would have been October of 1918, which was the most horrendous month and throughout the entire pandemic. And you can see some similar numbers, although our numbers actually aren't similar. They're just from January to May collectively. So within, I think January 21st is really the counting start date to May 3rd. In New York State, we've had 23,000 people die. So in 1 month in 1918, they had 35,000 people die 1 month. And in 4 months or so, we've had 23,000 people die. Just some of the other figures here. Mortality rate of Cook County Hospital, Illinois in 1918, 39%, which just kind of blows my mind. I can't even begin to wrap my arms around that. In 1 month in the entire US, October 1918, again, which is the Sentinel month, 195,000 people died in 1 month across the US. 1 week, October 19, the highest rate. In New York City alone, 7,800 people died, which you can see is about 1/3 of the total people that died between January and May in this pandemic. So, I mean, these numbers are just really kind of astronomical. The only number that really compares at all from 1918 to 2020 is that the high one-day figure. So the high one-day figure in 1918 in New York City was 850 compared to on April 9th, 2020, our highest in New York State was 799. Now again, that's the state compared to just the city. So again, you can really see the impact of 1918. This is just a picture I found in one of my references. I believe this is out of New York City. You can see it's a rather large auditorium. You've got people wearing face masks. It appears that the people who are sick are socially distanced, but the people who are working, of course, you can't be. There's no way you could do that. But that is one of the things that they began to realize, we've got to keep people apart. And so they were really doing their best that they could in regard to that. This is a pretty amazing picture. This would be akin to the setting up a hospital in the Javits Convention Center in New York City this time around. This is a great slide. I found this. It looks like it was hand-drawn back then because it was a long time ago. But what is great about this slide is you can see anything that you read really talked about 3 waves. There was 3 waves in the pandemic of 1918, 1919. It actually began over here. You can see to your left, 1917. Like you can see the high numbers were between June and July of 1917. And then kind of like, you know, things kind of went along. Some curves flattened and lowered. Other curves did not flatten and lower. I believe that curve is Berlin up here. This is Berlin. These bottom ones are, the solid line is the United States. And you can see it really hadn't hit us too much in 1917 yet, but we had little bumps and flexes. But what they say happened here is that everybody got relaxed and, you know, thought kind of, okay, let's go back to normal. And then whoop, your worst wave. Your second wave was your worst wave in the 1918 pandemic. And it hit, it's with the Sentinel month. This is October up here. And this is the United States right here. And the next highest is London. It's interesting, you can see London kind of moseying along. And then all of a sudden they like jumped up just like we did, moseying along and then jumped up. Went way back down again, then you can see it kind of coming up again. So you've got your third wave over here, and this is London over here. London had another pretty significant wave. I'm not sure why our line stops there. That's the United States. I'm not sure why that stops. So I just really think this is a great slide to show the 3 phases. And then somebody just told me that Andrew Cuomo had shown this slide on one of his TV appearances. I said, oh boy. So what was Spanish influenza? Listen, I'm no doctor, so I'm just kind of reporting this stuff. I'm sure some of you better understand a lot of what this means, but I've written it in a way that we can all understand it. It's a type A influenza. It's most severe and deadly, and it was also, I had forgotten, because the word novel really didn't mean a lot to me then, but now I understand that again. The 1918 pandemic was called by a novel influence as well, birds. I think they found that it was birds, and it's novel again because no one had any immunity to it. And ours is novel this time because it was also animal, supposedly animal transmitted. But again, what's different with this Spanish influenza, this particular one, it attacked the healthy cells and therefore liked the younger and healthier victims. So as opposed to ours kind of preying a bit more on the elderly at this time, the 1918 version really liked the younger individuals, and it killed them at more rapid paces than it did the older adults. What really kind of got to me is these next 2 bullets was how this particular disease progressed was literally people bled out. I mean, I don't mean to make anybody sick, but literally there would be blood coming from every orifice in your body, and it happened within hours. It very quick, very, very quick. People would literally turn black. They called them mahogany, or in some cases cyanotic blue, because they had no oxygen beneath, and the blood was pooling beneath their skin. So make sure. Oh, sorry about that. I skipped this one. This, I had to put this in here because this is a quote. Again, this is the genealogist coming out me as opposed to the historian. This was a quote from a doctor who was at Fort Devens during the ascent into the October 1918 craziness that really, really put it into unbelievable categories of death and impact. But what he's saying in here, I've never seen anything like this before. I've never seen anything like this. They get to you and they literally die within hours. And in his last thing, which is like, I don't mean to laugh about it, but he said one, poor devils dropping like flies sort of gets on your nerves. And I'm thinking, oh my God, is that an understatement? So just kind of like the unbelief. I've never seen anything like this in my life. And it's horrible. A doctor reporting that from Fort Devens. Okay. Now we're in, remember that first wave, the slide I showed you just a couple things ago, the first wave, 1917, it starts. Researchers have said that they've traced, and they did tracing, they traced the genesis of the flu in this country to two men in Haskell County, Missouri, two young brothers who were getting ready to go off to the war. They had recruited to go off to war and to Camp Funston in Kansas, right in the breadbasket of our country. And they reported, and by March, so they reported mid-February, and by March 4th, 1,100 soldiers had been admitted to Camp Funston Infirmary and 40 died. So in 2 weeks, 1,100 sick and 40 died just from those two men. And by the next week in Fort Riley, which I believe was the next closest one, 100 are sick and 500 more are sick by the weekend. So you can see the rapid transmission of this particular flu. And all while we're doing that, you can see what's happening over here on the right side. We are building up to go to war. You can see the recruiting opportunities. What a wonderful thing to you. We'll take you around the world. You can see the world. So it's kind of these two conflicting things that are happening. So as a World War I, we're building up for World War I. In March of 1918, they begin to notice that two other camps are heavily infected, and that cities near the Army and Navy bases begin to see, more of a flu. Now they don't know yet what's coming, but they see, oh wow, something's going on. And in this next comment, I like, because I'm thinking, boy, haven't we been reading a little bit about that? No alarms made nationally. There's things that are buried in the back, the back news stories, but experts are sounding internal alarms. They're going, what's going on here? We got to get on top of this. We haven't seen anything like this before. So then the summer rolls around, people want to get out. They want to have a good time. But obviously people are letting their guard down. They're still congregating. Now this picture here on the left, that's actually Buffalo, Main Street, Buffalo. I think I took that off of one of the Buffalo Historical Society web pages. But you can see, wow, that's a big crowd. I believe it's Memorial Day. So everybody's out having a good time. And in May 18, 1918, your draft for troops is initiated. So before that, people just been reporting that had voluntarily said, I'm going to come forward. Now they're drafting people, and you've got to come. So more and more people are getting into the military thing. Now you can see so far, I've only really talked about the primary infusion of the virus has been through the military and in the military. So you can kind of think that people are saying, oh, that's the Army's problem or the Navy's problem, blah, blah, blah. So now we're into the summer of 1918, and we're starting to see that second wave. You remember, you saw that slide, how quickly it ramped up. So you've got, and here's the virus is mutating and the troops are building up. So you put those two things together. They're putting men on boats in freighters with infected men, and they are landing in the ports of Philadelphia and New York City in order to be shipped overseas, right? New York City Department of Health reports now, okay, the flu is back. They're seeing a lot of the sickness that they saw in 1917. They go, okay, it's back. We got to do something. And they see again August 27th in Boston, the Commonwealth Barracks, 58 people are infected in one barracks. And now you see it's starting. Now this is fascinating to me. The second wave is building September, which is just 1 month before the October, craziness. The first civilian deaths are noted in Boston and Harvard University. Now this is fascinating to me because right up until this time, they were really reporting it as a military issue. And now they're saying, whoops, we think civilians. Now that's not to say it really actually was the first, but now they're being noted more across the board. And in September of 1918 in Fort Devens, which is in Boston, they said more are sick here than well. There are dead bodies stacked about the ward like cordwood. I mean, what a visual is that, right? I mean, can you just see that? It's mortifying. And finally, September 5th, 1918, they announced that it's an epidemic. So it took the United States government over a year, effectively, to really say, I think we have a real serious problem here. Not just a problem, but a serious problem that's going to affect many, many, many people. So by mid-September, 1918, you've got in one day, 1,543 soldiers are sick at Devens. 20% of the camp is ill, and they closed the hospital there. You can see the Fort Devens, Massachusetts. Doctor says men dying in a matter of hours. They have mahogany spots on their cheeks, cyanosis from their ears to the face. It's hard to tell colored from white. 100 deaths a day right now. This is just in an army fort, 100 deaths a day. Now the war transport activities bring the sickness to all corners of the globe. So you've got all these infected men, the ships are going across, across the Atlantic, and you can only imagine the horror from all that. Camp Hancock, Georgia, 2/3 of 3,000 men were sick and 10% died. Camp Custer, 2,800 sick. Camp Grant, Illinois, 5,006 and 500 dead. And here is a sad note. The commander of that particular camp killed himself. I read that and I still get the chills when I read that. It's just amazing and very deeply sad. And I just read it yesterday. A young doctor from New York killed herself. Okay, fateful October 19 is at hand. Now here's where it gets funny. We're at war. So I read an article just the other day. It was from 2005, but what was interesting, it really made a very interesting observation about the intersection of the war with this particular pandemic. And the interesting intersection is that when you've got a world war going on, no one wants to tell anybody, their enemies, what's really going on in their country, because that will be perceived as a sign of weakness. So no one is talking. They don't want to come out in public and say what's going on because they're at war and they don't want any of their enemies to have the upper hand. But so you've got people, the politicians, trying to play it down, but New York City has cases now, but says no need for worry. Now here the future President F.D. Franklin Delano Roosevelt takes Illinois, New York. I think he was a Secretary of State at that time. September 13th, October, 198,799 cases reported of the flu in U.S. Army camps. That's like the size of Buffalo. that's an amazing figure. And President Wilson is ignoring any talk of the disease and continues full buildup and transport of soldiers in what they called post, the discussion is death ships. Just amazing. Okay, here's some more local, local. So here's some local flavor. They start putting, telling people you can't go anywhere. Okay, so we have the pause. They started putting out these warning and ask the citizens cooperation. You've got to, we're going to shut down places. So the Lockport Board of Health is urged to shut down public place. Places are sprayed. Now, I can't even tell you what that meant. Whatever that meant, they sprayed immediately. I don't know what they sprayed it with. Who knows? Public request to not allow children to congregate. And Buffalo is under more severe conditions and shuts down all their public places. So you can see there was not a coordinated response here. So Buffalo's doing one thing, Lockport's trying to do another thing. We're not having, they had never been through anything like this before, and really had nothing. I always say history in crisis sometimes has a short memory, and there was not enough, knowledge to back up how they had to handle this. And in fact, think of what they had back then. I mean, they were, on radio operators, newspapers were their primary form of mass communication. I don't even know where radio was at this point. And, maybe some of you guys can help me with that. But it was kind of, we're going to do one thing here and other people doing another thing here. Now, 25,000 cases were reported in New York State, not including New York City. So that was in addition to what was going on in New York City. As you can imagine, medical personnel were in short supply. They had no idea how to manage this in terms of, hospitalization and so forth. Severe shortage, because they're at war, so they had a lot of their medical personnel were at war as well, and also sick. And so they really started coming, a lot of people back from who had retired, and many new joined. They put a lot of medical students to work. As you can, I think you see some same actions like that happening now. And there's a picture of a nurse of the day. Now we're in the end of October, and you can see they're reporting in Lockport, the epidemic is on the decrease. Only 51 cases reported Sunday, and 74 today's total. Another physician is ill. So you have your doctors getting ill. Dr. Warren Loomis, who I think was the local health officer for, they're starting to see the staff take the brunt of this as well. And I'll tell you, we've got coronavirus overload in the media, but it was similar here. I mean, when I started reading these 1917, 1918, 1919 newspapers, it was all over the place. And in fact, papers, as they did during the day, they were reporting all your business. So, they put your name in there and say, Hattie Edgington, age 22, and she's the wife of Howard, now in service in France, died early yesterday morning, the residence of her father-in-law, a few days illness with influenza. Obviously personal, information wasn't mattering as much back then. She had influenza and it terminated in heart trouble, survived by her sister. And then they go on, right down. You can read the article on the right. They're giving, little snippets about everybody. And a lot of them had to do with that they died from the influenza. And you can see the ages here. Now you've got some of your elderly, you have an 81-year-old and 68, but you see a lot of really young people. And there was a little article called, people on Hess Road who recovered, Muriel Parker. And so I just put this up here as kind of interesting. Some of you may know some of these people, I don't know, but it was just all very personal. And they were, every town was keeping track of who was living and who was not living. Let's see. Late October, there was a second day of case decline again. So now they're really monitoring, and I think this is interesting. They're really monitoring day to day what's going on. There's, they're kind of getting organized around the reporting, and you see another big drop in cases. A big article that was in the paper on that day, and they are. But in the middle of this serious article, they do talk. There is a ban on Halloween parties, which I mean, some of these things you would read and you see the serious stuff, and then that local flavor, but your kid can't go to the Halloween, Halloween party, So yeah, that was interesting. Just more deaths again. This is again. Local genealogy person myself wanting to say, here's, some of your people died during this epidemic. So on the end of October, looking at things must have been changing, their communication must have been changing. They went back to the bans again. So they kind of took the bans off, they put the bans on, they took them off, put them on. Now they're banning public funerals and church services, which we are all familiar with that now. You have to stay away from private and public gatherings. So they really, I think, on a more broad level, Lockport even looked at this and said, we've got to get our act together here. All bodies had to go on the ground in 24 hours, and undertakers must place the body in a casket as soon as possible after death, and it must be closed immediately. So they had some very specific rules about how you were to be handling the body. Now, on the same hand, you've got Newfane and Wilson, which for people maybe out of state, Newfane and Wilson are, 10 miles from each other. They lifted their quarantine on October 30th. So you've got one Lockport who is 15 or 20 miles from Newfane and Wilson putting the clamps on again, and now you've got Newfane and Wilson lifting their quarantine. Even though, despite that, in Newfane, they're not going to have church services. So they were picking and choosing, like we kind of are now. We're in that kind of like, what should we open up? What should we keep closed down? And then Wilson is saying no restrictions next week. So they're already calling it next week. You can do what you want to do next week. Again, end of October, Elwood Corwin left town. They loosened things up. He left town. He was stricken with influenza on the train near Columbus, Ohio. I just love some of these little personal snippets. Orangeport, which is Gasport area, which is just to the east of Lockport, right on the border of the town of Lockport. Their schools are going to be open after you see Lockport kind of shutting things down. They had been closed 2 weeks from the middle of October through the end of October. Now you compare that with our response to schools today, and we've been in lockdown since mid-March. They're not allowing church services, and postal carrier Arthur Manchester is stricken. Excuse me. Oh, no. Ban's on again. Gasport, which is Orangeport area, late November, they're putting the ban on again. So you can just see I can't even imagine how hard this must have been trying to figure all this out and coordinating without the modern communication systems that we have today. These people are, getting on their horse, getting in. If you have a motorized car, you're probably, wealthy, but you know, a lot of these Niagara County is a very rural area. It's hard. It's hard to coordinate all this stuff, and they really, again, they didn't really know what they were doing. Now we're into December of 1918. School's back on in Reynolds Basin. Reynolds Basin is just a little bit more east of Gasport or Orangeport. So you know, Lockport. We're in the eastern end of Niagara County. These more rural areas. They close school again. No services again in the churches, and then they also said, and they're noting patients who are recovering. So they're trying to give this kind of balanced perspective that while we're closing, people are getting better, and you know, hang in there with us. Now this was the month that my great uncle died. He was a manager of a theater in Erie, PA, and he died on December 9th, and he was part of that unfortunate group that probably was a lot among a lot of people, and he caught the flu and died, and his young child and wife was sick as well, but he died, and ended up he's buried in Lockport now. More people, and I remember reading this, probably one of the, you know, many things that I read during that time, and I just think about this statement that this doctor made, who was treating the ill. I think this epidemic is likely to pass away, and we are no more familiar with the control of it than we were in the epidemic of 1889. It's humiliating but true. It's staggering that a learned man would say that, and it's hard to think that as advanced as we thought we were, we had a really, really hard time getting a handle on what was going on. The treatments. Here's some of the things you say, well, what did they use to treat these individuals? Well, I mean, there's the list. It's pretty easy to see. There's nothing real magical about it. Some things to maintain pain, you know, improve of oxygen. Again, codeine is probably, again, we know what codeine is, a pain and makes you go to sleep. Hydrogen peroxide helps keep things clean. And this was interesting. This was something that was developed during the pandemic. They learned that Vicks Vapor Rub, if you put it in your nasal area, would help prevent the pathogen from attaching to the mucus of your membranes. And I know that I read that up still to this day, that is something that you can do. Mustard plasters. I'm not really sure what mustard plasters are. I think they were things that you used to put on your chest for something. Maybe one of you guys out there can help with that a little bit. And of course you have the quacks. You have over here, Father John's medicine. You know, the good father selling his elixir to avoid the Spanish influenza. And other preventions. Two of the major things that did come out of this were covering your mouth, the face mask idea, and the whole idea over here, you can see on the right, do not spit, cough, or sneeze. So they were recognizing that it was an airborne transmission. They did really learn that in a serious way, and they really worked with people to cover their mouth, and the whole, you could get arrested for spitting back then on the ground. Just kind of think some summary, some of the other impacts, things that I had read and kind of pulled out a variety of different articles and research and so forth. Caskets on the porches and in yards. It was a visual. You know, again, no public funerals or gatherings. friends and family digging graves for loved ones. Can you imagine with all these people dying and kind of the inability, lack of mobile capability to move bodies around, to store bodies? What did you do? People dug graves for their family ones. And you also can see a number of the couple of the cemeteries I have worked in. Sometimes your records are a little inaccurate or in some cases non-existent, just because there was no time to take care of all that. There was a shortage of caskets, morgue space. We know that today, the same thing. Public amusements were closed, schools were closed, mail delayed. Although we haven't seen too much, haven't seen too much of that. Severe shortage of medical personnel in both war and at home. Because the push and pull with that was that it was almost like military first, right? So we kind of got people at home got the short end of that stick. And then again, the financial impact, which we all are feeling today in every which way, and it's so poignant, you don't really have to expound on that. And another interesting thing, again, having to do with the phone system, only emergency calls were allowed. So even if you wanted to make a call, I think a lot of people were on party lines at that point. You couldn't tie up your lines, especially in a county like Niagara, which was again highly rural in many cases. This again causes shortage of essential personnel to assist the war effort. The influenza, stopped again. We know what that's like, and it created a worker supply issue. These workers were assigned to support essential war efforts. So you either went, if you couldn't work in your business or in town, you had to go work for the war effort. So and this is probably more of a male issue, but you had to go do one or the other. So you had to, work in your community, or you had to join, work for the war effort. Military is kind of ruling a lot of this, and probably ways that they looked afterward and said, wow, that was a tough kind of tough choices to make. Okay, and these are some of my references that I use. They certainly welcome to take a look at these later. Again, I think we're going to be posting this piece in two ways. I know we're obviously recording it right now, and it will be posted on YouTube, but I believe we will get a copy of the slides up as well. But there's these are some interesting resources for you to look at. So I want to thank you very much. I think what we're going to do is end now, and we're going to take questions, and looking forward to providing what insight I'm able, and also hearing the insight from the people who joined us. I think that'll be equally as helpful. So thank you very much.